At the Loyola University Parkinson School of Health Sciences and Public Health, we are committed to the dictum of the World Health Organization, which says that the highest attainable standard of health is the fundamental right of every human being. So we are committed to health equity. That sort of is the mission of everything that we do. How do we promote health equity? How do we reduce health disparities? Frankly, there are a lot of organizations in town which promise to do similar things to HC3 in terms of convening people, working on important issues, especially health equity, etc. But when I met with Meg, what I've discovered is, oh, you really not only talk the talk, but you really follow through on things. One of the major projects that we have, a signature pillar event, is the Loyola University Health Equity Quest that we do every year. It reflects our philosophy that you can't solve complex problems in areas such as health by looking at through one lens or one discipline only. It takes a lot of different disciplines to get at these issues, and not only multiple disciplines, but multiple sectors. This year, instead of a summit, we did a pitch competition, an innovation challenge on mental health innovations for early career professionals. I met early in the process with Megan, and it wasn't only a sense of like how to promote it in the newsletter and get the word out on it, but she actually helped us conceive of what the event could be. And then she says, oh, and I think you need to speak to this person and that person. Just key introductions, key people in terms of how we were even conceiving and who should be involved, etc. And that was immensely helpful for us to be able to do the event. And we've had a lot of partners, but HC3, Megan specifically, is really passionate about the issues, is really knowledgeable, and is willing to share her knowledge and share the network. So it was a very successful program. We wouldn't have been able to do it without HC3's help. So we're all about impact. Our specialty is really having our students trained with a health equity focus to make a difference in terms of the next generation and in terms of what sort of public health interventions can we create, what sort of community initiatives can we work on with community groups, etc. Where are there areas where we can bring together different members of HC3? How can we leverage the different strengths and resources of the organization? Because for complex health problems, we're going to need multi-sector representation. HC3 represents all those different types of member organizations. The founding director of the Parkinson School is Dr. Dean Elaine Murato. Dean Elaine comes from industry, and she brings that sort of multi-sectoral approach in terms of her own understanding. I saw a video, and in it she was saying that every graduate of the Parkinson School needs to be a health entrepreneur. Now, what does it mean? Most people think entrepreneurs are you're starting a business. That's not the definition that I like to use. Is entrepreneur somebody who's trying to solve problems with limited resources. In the same way, Dean Elaine said that every graduate needs to be able to identify a critically important problem, develop new ways of solving that problem, be able to prototype and develop that solution to the problem, and then once they have the solution, be able to sustain and scale the work. And that sort of encapsulates my philosophy. It's not about just studying problems in health, and it's not just about doing events on health. It's how do you actually come up with ways to solve specific problems in an entrepreneurial, innovation-based way. And that is, I think, our unique value proposition, is what we offer and what we look to other organizations and businesses, etc., who have that similar thing and who want to develop with us. And I know that is exactly what HC3 also believes too.